This video is brought to you by Dorset Healthcare University NHS Foundation Trust. We're a community mental health provider in Dorset.
I'm Vokes and I'm one of the community tissue viability nurses.
And I'm Darren Wickwar, I'm our Trust Nursing Professional Lead.
This year's Stop the Pressure campaign is based around risk assessments. So we're excited to be discussing nutrition with you as part of the 2022 campaign. There is much evidence to support nutrition and hydration are fundamental aspects of wound healing. Pressure ulcers and all hard-to-heal wounds require adequate macronutrients and micronutrients, iron, vitamins and fluid for optimal wound healing. Energy is required for increased cell activity and collagen synthesis, angiogenesis and immune function. Obesity has also been linked to impaired wound healing, with an increased body fat linked to lower lean body mass and protein deficiency. In older adults, the risk of dehydration is high, typically because they have decreased lean body mass and increased body fat, reducing the amount of water stored in the body. This, combined with multiple comorbidities, can increase the risk of dehydration, which will delay wound healing.
In Dorset Healthcare, we use the MUST risk assessment. This helps us to assess patients' nutritional status. MUST stands for Malnutrition Universal Screening Tool. This has been adopted in all our settings, including community hospitals, mental health units and the community setting.
So Darren, what challenges do we face in practice in regards to this tool?
MUST can often be forgotten or not completed.
And why do you think this could be?
Sometimes time constraints can get in the way and the challenge of equipment can be an issue also. For example, scales. Staff might not have taken the scales with them, the scales might not be working, and staff aren't always aware of alternatives. Measuring mid-upper arm circumferences and measuring the ulnar length. Patients have reduced mobility, preventing them from getting onto the scales. And sometimes staff can become task-focused, only doing what needs to be done rather than providing holistic care. Conversations with patients, family members and carers don't always occur. Other challenges may include ill-fitting dentures or missing dentures. Patients also often have concerns about being able to get to the toilet when they need it. Patients also struggle sometimes to access food and fluid. This is particularly a challenge in the community setting.
So despite these challenges, can you give us any examples of good practice?
Yes, we use the ESKIN acronym. This helps to prompt staff to think about nutrition and hydration. Our staff can refer to community dietitians who will support patients in ensuring they're educated on what food is required to help with their wound. I'm aware of a patient who had a category 4 pressure ulcer. They were obese and suffered with diabetes. The challenges were faced in managing their diabetes, eating enough for the required increased energy levels and protein intake to promote wound healing, whilst trying to ensure their weight did not increase considerably. The district nurses involved community dietitians, diabetes nurse specialists and the tissue viability nurses to ensure that all elements of the patient's care were met. The patient also referred herself to Steps to Wellbeing as she recognised she was becoming depressed, not being able to eat the food she enjoyed, and being on prolonged bed rest meant that this had had a detrimental effect to her mental health. It was an excellent example of a holistic multi-professional care, multi-professionals working together, a pressure ulcer healed. Other examples of good practice was found in one of our community hospitals. They simply recorded on the patient's whiteboard the time that their ESKIN bundle was due to be reviewed. This prompted their assessment to be completed in a timely manner.
Good. While some might consider Dorset as a place where everyone retires, which it is also a place where people with multi-faiths live. We've also seen refugees here in Dorset who cannot speak English and they have very different dietary requirements. This naturally brings its own challenges in terms of nutrition and hydration. In addition to this, we also look after patients with varying dietary requirements, including vegan, vegetarian, celiac, dairy-free, to name but a few. Advice is given to respect people's varying dietary requirements, and we will often involve our community dietitians for further advice.
We also look after patients in our community hospitals, mental health units and in the community setting who have difficulty in swallowing. We may need to manage this by using fluid thickeners, pureed diets and referring them to speech and language therapists for their input to develop a safe swallowing plan. We encourage good mouth care for patients who have difficulty swallowing. One of the challenges that we sometimes face is often referrals to other professionals can take time due to their heavy workloads and demands on services. A face-to-face review may take several weeks, if not months, to take place. Most of our services operate a triage service which prioritises patients who are more severe and in clinical need. However, this still takes time. Therefore, being trained to be able to complete safe swallowing assessments on our wards to assist us to provide safe care.
Patients who are nearby mouth, whether that's pre or post surgery or because of an injury such as spinal patients who we'll see with tissue viability, this naturally affects their nutrition intake, and often we will refer to nutrition nurses for their support in enteral feeding. That concludes our discussion about nutrition. Thank you.
Thank you.